Welcome to my channel and welcome to the fourth part of this topic, that is spinal cord. So I hope you have watched the previous 3 videos regarding this topic, in which I have explained many things about the spinal cord, and in today's video I am going to explain about the descending tracts, or the most commonly used terminology, that is pyramidal tracts. But before I jump to this diagram and start explaining you the different neurological terminologies, so first let us focus on some of the general informations and some of the clinical aspect which we can determine whenever we see any patient. So the first thing is, these are the tracts which are concerned with the voluntary movements of our body. Second important thing is about the pediatric population, that these are the tracts which are present since birth. But remember one thing, that myelination of this tract which is completed about 2 years of age. Third thing about the geriatric population, that is the older people. So in the geriatric population, there is tendency of this tract that they disappear. So this disappearance of the tract, which is manifested by vibration, or I can say the shivering movement, which we commonly observe in the pediatric people. But do remember this thing, the shivering can be due to many different reasons. But for a typical pyramidal tract, so as they start disappearing, so the shivering or the vibration kind of movement can be observed in the geriatric population. So now let's start with the pyramidal tracts or the descending tracts, and the third name, that is the corticospinal tract. First I will explain you the origin, then we will see the course, and then comes the termination. So let's start with the first one, that is the origin of the pyramidal tracts. So origin is from the main 3 centers. So as you can see in this diagram, that this is the cerebral cortex, this area is the cerebral cortex. Now cerebral cortex, there are actually many areas which are present in the cerebral cortex, but for a pyramidal tract, whenever we are studying the pyramidal tract, we need to remember 2 areas that I am writing it over here. That the first area, that is area number 4. Second thing is the area number 6, and the third thing is the somatosensory area. Somatosensory area. So these are the 3 areas from which the pyramidal tract gets originated. Let me draw it over here, that area number 6, and suppose this is our area number 6. Here comes the area number 4, and some of the somatosensory area which are located over here. So these are the main 3 areas which are responsible and from which the pyramidal tract gets originated. So area number 4, there is another name that you commonly find in different books, that usually I write it as area number 4, but you may find some other name, that is the primary motor area. Let me write it over here, that is primary motor area. And for the area number 6, it is premotor area. Premotor area. So both are same. If you write it as a primary motor area or the premotor area, that is suggesting of the area number 4 and the area number 6. So these are the 2 areas which I have shown over here, and they all are not giving rise to 100% of the fibers, right? So area number 4, it only gives the 30%. Area number 6 giving its 30%, and the rest all, that is the 40%, it is given by the somatosensory area which is present in the parietal lobe. So that is the origin of the pyramidal tract. Now from here, pyramidal tracts, they are going downwards. So they all converge. There are many bundles of fibers, and this bundle of fibers, they form a structure named as an corona radiata. Now corona radiata, that is a fan-like structure. If you can see over here, that it is a fan-like structure which is formed after taking the origin, and they are descending downwards in the white matter. As you remember that in the spinal cord, the grey matter is in center and the white matter is in the periphery. But whenever we go to the higher center in the brain, white matter is in the center and the grey matter is in periphery. So after taking the origin from the grey matter of the cerebral cortex, they are running downwards through the white matter, forming the corona radiata. But here one thing that I have mentioned in my previous video, that a structure named thalamus, which is present over this site, and the ascending tract fibers, they are coming from the spinal cord up to the level of the brainstem, and they are entering into the VPL nucleus of the thalamus, that is the ventral posterolateral nucleus of thalamus, and they are also going upward up to the sensory cortex. Now you may imagine that they are also going upwards and these fibers are also coming downwards. So corona radiata always contain both. They also contain ascending tracts, they also contain the descending tracts also. So here there is a formation of the corona radiata. From the corona radiata, it forms a internal capsule. So internal capsule, it is this kind of structure which is formed, that is the internal capsule. We must remember some of the relation of the internal capsule, that over the medial side of the internal capsule, that is towards the midline, there is thalamus, and over the lateral side there is one nuclei which is present, which is known as an lenticular nucleus, which is present over the lateral side of the internal capsule. From here, the fibers are going downwards and at the level of brainstem. At the level of internal capsule, they all converge from the corona radiata. Now they are going downwards. Let me show it over here. As I have shown that this much area is cerebral cortex, now this area, it is the brainstem. And brainstem, the structure from the superior to inferior, there is midbrain, then comes the pons, and the last one and the most inferior one, that is the medulla oblongata. Now fibers which are coming from the internal capsule, they are going downward at the level of pons. Initially there is midbrain, then comes the pons. So pons is the very important structure because it contains many nuclei which are responsible for vital functions of our body. That it also gives origin to many of the cranial nerves. It has also cardiorespiratory center and many other centers are present. So pons, it shows multiple nuclei. This is, for example, I am showing you that multiple nuclei which are responsible for vital functions of our body, they are present, and when fibers are coming, they are divided. They are divided into different bundles at the level of pons because of the nuclei which are present. So at the upper border of the pons, they are getting divided. Okay, so many divisions that you can see, and they are going in between those nuclei, and then they are coming downward at the level of medulla, the last portion of the brainstem. So when they are coming at the upper border of the medulla oblongata, they are again converging and forming a large bundle. So this large bundle and the appearance, this kind of appearance, as you can see over here, this kind of appearance is known as a pyramidal shaped appearance, and this is one of the reasons that why do we call a corticospinal tract as a pyramidal tract, because at the upper border of the medulla oblongata or the lowermost portion of the brainstem, it gives appearance of a pyramid. That's why it is a pyramidal tract. And as it passes downward, at the lower border of the medulla oblongata, they are again divided. So let me draw a small diagram that at the lower border of the medulla, this is the section of spinal cord, and let me show now the unequal division of it. That when they are going at the level of lower border of the medulla oblongata, fibers are unequally divided. Unequal means, suppose the 100% fibers are coming up to the level of medulla oblongata. Now they are divided into 80-20%. Means 80% of fibers, they are crossing the midline. 80% of the fibers, they are crossing the midline, and the rest all 20% of the fibers, they remain in the same line. Okay, means they do not cross the midline. Rest all 80%, they are crossing opposite side. So the fibers which are coming, they cross to the opposite side. So fibers from, suppose this is the left side and this is the right side. So the left side fibers crosses the midline coming to right. From the right side, fibers are crossing the midline and they are reaching from right to the left side. And rest all, that is the rest 20%, they remain in the same direction. They do not cross it. So here, this crossing of the fibers, which forms a pyramidal decussation. Crossing of the tracts from right to left and left to right, it forms a pyramidal decussation, and the rest all 20%, those are known as an uncrossed fibers. Now in the spinal cord, we must identify the location. As I have explained the transverse section of the spinal cord, in the center portion there is grey matter, peripheral portion there is white matter. But the location of this corticospinal tract in the spinal cord, it is very important that, suppose I draw a small diagram over here, that in the center portion there is grey matter. So this is the anterior white column, this is lateral white column, this is posterior white column. Similarly on this side also occurs. But the fibers which are coming, so they lie over here. That is the posterior portion of the lateral white column nearer to the posterior grey horn. And the fibers, those 20% uncrossed fibers, they are going in the anterior white column. So the posterior portion of the lateral white column and the anterior white column is the location of the pyramidal tract in the transverse section of the spinal cord. So for the termination, these two tracts, that is crossed tract and the uncrossed tract, they are terminated into the same, that is anterior grey horn. Terminated over here, that is the anterior grey horn into the alpha motor neuron and the beta motor neuron. That is alpha and the beta, or I can say the gamma motor neuron. Let me write it over here, that is the gamma motor neuron. So that is the termination. Termination can be direct termination into the anterior grey horn or via the internuncial neuron. So internuncial neuron, it is nothing but it is a kind of extra neuron which is present and which helps a tract to terminate in a particular grey matter. For example, here the anterior, that is the anterior corticospinal tract, it may terminate via internuncial neuron present in the anterior grey horn of the spinal cord in the transverse section. And from here, a spinal nerve arises and that spinal nerve carry the motor impulses. So I hope the concept is clear to you. Now as it is a very important topic, we must revise all the levels and the important structures, that is the origin as well as the course, and the main important, that is termination, and at last that is function. So let's do a quick revision of it. So first let me rub all of these. So first of all, this area is the cerebral cortex, this is the brainstem, and let me write it over here, and this is the transverse section of spinal cord. So the first one, that is the origin. So origin is from the three areas. Area number 4, that is the primary motor area. Area number 6, that is premotor area, and the somatosensory area present in the parietal lobe, that is the origin. Then they form a corona radiata. That, let me write it over here, that they form a corona radiata. From the corona radiata, it converges and it forms the internal capsule. Internal capsule. From the internal capsule, they are going downward into the brain stem and at the level of pons. Because of the many vital nuclei which are present, which are responsible for many vital functions, they divide themselves into a many small bundles. So it gives a pyramid shaped appearance. Pyramid shaped appearance at the level of upper border of medulla oblongata. In short form, I write it as a MO, that is medulla oblongata. And at the lower border, it again converges and give a pyramid shaped appearance. Pyramid shaped appearance in the spinal cord. It divides unequally, and 100% fibers, they are appear at the lower border of the medulla oblongata, but at that particular site they are crossing midline, they are forming the pyramidal decussation, and in the pyramidal decussation 80% of the fibers, they are crossing to the opposite side, they are crossing the midline, and the rest 20% of the fibers, they remain uncrossed. They are known as an uncrossed tract or the uncrossed corticospinal tract. So that is all. In short, I can say that the whole summary of the pyramidal tract. Now comes the most important thing, that is the functions of the pyramidal tract. So functions of pyramidal tract, as I told you, that they are mainly concerned with the voluntary movements of our body, but it also regulates the tone, it also regulates the reflexes in our body. So when I am going to take the pathology, or I can say the different conditions of the neurology, I will explain you at what site, if the lesion is present, this may show different symptoms. So depending upon symptoms, you may categorize the lesion, that the lesion is present at the level of brainstem, lesion which is present at the level of the cerebral cortex. So for now, this is the out of the scope of this video, but definitely I will make a video on the applied physiology of the pyramidal tracts. So that was all about the pyramidal tract. I hope now this concept is clear to you. If you are having any doubt, do let me know in the comment section. Till then, keep learning, keep exploring. Thanks for watching the video till end.